Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. As you all know, I'm a breast cancer survivor in remission, and my traumatic experience led me to launch a YouTube channel and Facebook page where I seek to discuss with experts and other stakeholders about anything and everything pertaining to this cancer disease. I also share snippets of my experience from time to time for everyone to get a feel of how devastating this disease can be. And the rest, they say, is history. On today's show, I shall be bringing along a key stakeholder as a guest. He is the MD, CEO, Green Acres Hospital and Gynaecare Clinic in Abuja, Nigeria. And he is also the visiting chief consultant of the National Hospital, Abuja, Nigeria, who is doing a fantastic job at keeping our mothers, our sisters, our wives, and our friends as healthy as possible. On today's show, we shall be looking at cervical cancer, what men need to know. Yes, many of you will be surprised to learn that men play a role in a cancer which occurs only in women. Now, how on earth is that possible? Well, we'll soon get to find out. So, without much ado, I welcome to the show Dr. Yinka Olaniyan. Dr. Yinka Olaniyan, you're so welcome. And thank you so much for taking time out of your busy schedule for this pertinent and very timely discussion, sir.
My pleasure to be here, Grace. And thank you for the very good job that you're doing.
Thank you very much, Dr. Olaniyan. We have so many questions to ask you today, so bear with us. So. I got some questions also from some members of our community on the Cancer Convos with Grace B page on Facebook. So I shall be asking you a couple of those. Just so our viewers can understand where we are coming from, I was privileged to have visited your hospital in Abuja with my team. And I witnessed the way that your outfit was run with very high standards. And I must confess that that was what actually gave me the confidence to be able to bring you to the show and have this very timely talk with you. Thank you so much.
Thank you so much, Grace.
Yes. Like our parents would say, we sabi the pikin from a compound. And from those of my friends who don't understand what I'm saying, it's Nigerian Pidgin English, which means we know the child right from his roots. Dr. Olaniyan, you're a very well-known and respected obstetrician and gynecologist with vast knowledge about the female anatomy. However, we are very particular about this nagging cervical cancer disease because we've all lost dear ones to it. Why is this? And could you please begin by explaining to us what exactly is cervical cancer?
Thank you so much, Grace. Cervical cancer is cancer that affects the cervix. Now, the cervix of a woman, it's only women that this is concerned about. The cervix is the neck of the womb, so to speak. So the cervix of a woman is part of her womb. It's the part that is exposed to the man during interaction, and it's the passage into the woman's womb. So when a cancer occurs on that part of a woman's anatomy, that's called cervical cancer.
Okay, all right. So I'd like to ask, how common is it? And is it hereditary? Because something like breast cancer is considered hereditary. Is cervical cancer hereditary?
There are some very rare types of cervical cancer that are hereditary, But by and large, the vast majority of cervical cancer are not hereditary, and they are in fact related to lifestyle. As
Okay.
to how common it is, each year there are about 500,000 or more new cases of cervical cancer worldwide, and over 250,000 maternal deaths due to cancer, deaths of women due to cancer occur worldwide. And unfortunately, the bulk of this burden is on the third world. So you have more than 80% of the cancer burden, cervical cancer burden, occurring in third world countries, who unfortunately also have just about 10 to 20% of the resources to battle cervical cancer.
Okay, that's interesting. So at least we do know that cervical cancer could be as a result of lifestyle decisions as well, right? Not necessarily hereditary.
To all intents and purposes, it's related to lifestyle.
Okay.
Very, very fractional part of it is controversially attributable to heredity.
Okay. All right. Thank you so much. Now, being the topic of discussion for today, what men need to know. What is the role of men in the causation and prevention of cervical cancer?
Thank you very much. Now, if there were no men, there probably would not be any cervical cancer, because cervical cancer is caused by a virus which is transmissible between man and woman during intimate sexual contact. So it is actually transmitted by a sexually transmissible disease. So practically, if a woman was entirely celibate and didn't have sexual intercourse, she most likely would not have cervical cancer throughout her entire life. But if a woman has sexual intercourse, which women must in order to procreate, they become immediately exposed to the virus. It's actually a virus that passes between the man and the woman, both directions, that causes cervical cancer.
Mm-hmm.
This virus is called human papilloma virus, or HPV for short,
Mm-hmm.
and it's probably the most common sexually transmitted disease worldwide.
Wow.
Yes. If a young girl started having sexual intercourse, or should I say, if young girls started having sexual intercourse, within a year, about 80% of them would have been exposed to this virus.
Okay.
That's not a death sentence on itself, because the body of most people will naturally eliminate this virus without the woman ever being aware that she had the virus. But
Okay.
in a certain cohort of women, in a certain group of women, the virus is not eliminated naturally. The virus sits in there and initiates the process that eventually leads to cervical cancer. That's why I said at the beginning, it's very much a lifestyle thing.
Mm.
So you would understand from a little discussion that the more a woman is exposed to sexual intercourse from several parties, several sources, the
Mm.
more are chances of contacting human papilloma virus.
Okay.
Yes, and then I told you also that naturally the human body is able to eliminate this virus without effect normally. But in certain groups of women also, they have difficulty eliminating the virus. And those are the women who are at risk. Don't forget, we mentioned it's a lifestyle thing. So
Yes.
women, for instance, who smoke, women, for instance, who have HIV or are otherwise immunosuppressed, A small percentage of women who are on contraceptive pills also have difficulty eliminating this virus from their system. But
Oh.
by far, the biggest risk factor to a woman's inability to eliminate the virus is smoking.
Mm.
Either smoking primarily or a woman who is exposed to secondhand smoke. That is the biggest cofactor to the virus sitting in and initiating the process that eventually leads to cervical cancer.
Oh, wow. This is very eye-opening. Thank you so much for that. Now, what are the signs and symptoms? Yes, a woman could have that virus sitting in her because of for a multitude of reasons. You mentioned that there are two factors, most especially lifestyle, having sex with different partners, smoking. Um, for her to be able to know that she's been put out there and susceptible to this, how does she realize the signs and the symptoms of cervical cancer?
Thank you, Grace. I would like to correct a misconception so that we don't put the burden entirely on the woman, because we
Okay.
have just established that if a woman was having sexual activity with several people,
Mm-hmm.
she's at a bigger risk to
Higher risk.
higher risk to
Mm,
contract HPV. But
mm,
on the other hand, too, if the woman is faithful to one man and
mm-hmm.
the man in turn is
Goes
faithful
around.
to 10 other women,
Ha ha ha.
yeah, you can see
Yeah.
that it puts the woman at risk
At risk.
without
So
any
if
form
there's
of.
no faithfulness, if the woman is loyal to her partner and the man is not,
And the man is
so,
loyal to other partners, like I
and
like to
is,
put.
let us put it that way, he's loyal to other partners. So she runs the risk of getting that, of course, from her partner.
Absolutely. Absolutely.
That is very good. I like that ironed that out. So, what are the signs and symptoms of cervical cancer? What are the
Okay,
signs? How would she know?
good. Now, I'm going to take that question down one level because you seem to have stepped up a little bit by
Yes.
asking, yeah, what are the signs and symptoms of cervical cancer? But
Mm.
I'm going to bring it down. What are the signs of symptoms of HPV?
Of HPV.
Yeah.
Okay, which is the
There are,
virus. Yes.
yeah, there are absolutely no signs or symptoms of the virus that causes cervical cancer. In other words, a woman may be totally healthy, in quotes, and be on her way to developing cervical cancer because she has no signs, no symptoms at the early stages. Her partner also has no signs, no symptoms at the early stages. I'm
Mm.
saying this because I want us to situate very well the methods which we can institute to prevent cervical cancer. Because by the time a woman starts having signs and symptoms attributable to cervical cancer, the
It would
cancer,
have too late.
absolutely, absolutely. And if there was one cancer on earth that was theoretically possible to completely eliminate, that is cervical cancer. It is theoretically possible. If I may compare to other cancers, breast cancer, maybe not so, because by the time a woman discovers that she has breast cancer, she's got breast cancer.
Mm.
Even when you screen for breast cancer in a woman, by the time you find that she's got breast cancer, she's actually got breast cancer,
Yes.
but not the same with cervical cancer. But I guess our conversation will eventually lead to that direction, which I've just touched on the surface for now.
Okay.
So, signs and symptoms of cervical cancer, to answer your question,
Mm-hmm.
the cardinal sign is irregular bleeding. A woman bleeds inappropriately. In other words, she's
Bleeding.
not having her period and she's bleeding. She has intimate contact with her partner, and then she is followed by blood. I must make it clear that it's not every time that a woman bleeds outside her period that she has cervical cancer. 9 times out of 10, she doesn't have cervical cancer. It's not every time that a woman has intercourse with a partner and bleeds thereafter that she has cervical cancer. 9 times out of 10, she doesn't have cervical cancer. But these are signs that you must not ignore. When these signs occur, you must seek help to find out, why am I bleeding inappropriately? Why am I bleeding when it's not time for my period? Why am I bleeding after having intimate contact with my partner? It mustn't be taken lightly. 9 times out of 10, you will get a clean bill of health at the end of the day. But for that 1 out of 10, it may be life-saving if you report it early.
Thank you so much. So it seems you had already spoken about this, but who is at risk of getting it? The woman, of course. It's her. What should we say? It's her cross. It's the cross she has to carry. So it doesn't occur in men. It's the women. But how can it be prevented? Obviously, like you rightly said, that if she stays away from certain lifestyle habits, but how can it be prevented?
Okay, now traditionally, like over the past just a little less than 100 years ago, the only way we had to prevent cervical cancer was by screening, doing what we called pap smear. Pap smear is a short word for a Greek doctor who was Dr. Papanikolaou. He was the one who discovered that if you screened
The
women,
pap smear, yes.
yeah, yeah. So that's a traditional method which has been known now for close to 100 years.
Mm-hmm.
But in this day and age, there are other ways that cervical cancer can be prevented.
Mm-hmm.
That is, by preventing the activity of the virus itself. Knowing fully well, like I said at the beginning, that quite a lot of women within a year of exposure to sexual intercourse would get HPV, science has discovered immunization. You
Mm-hmm.
can be immunized against HPV. In
Mm-hmm.
other words, young girls between the ages typically of 8 and 14 years, hopefully before they get sexually exposed, can be vaccinated against this virus that causes cervical cancer. You must have heard of HPV vaccination. There are quite a couple of formulations of it. And this is the modern way to prevent
Okay.
cervical cancer.
Okay. Is it like
So,
screening for HIV? Is the cervical cancer screening the same as the HIV screening?
no. They're absolutely different.
Okay.
Yes, I told you for cervical cancer, is probably the only cancer that is theoretically we can eliminate 100%.
Mm.
If you screen a woman for HIV, if you screen a woman for breast cancer, if you screen a woman for other types of cancers, a positive test would mean that person was already deceased. I
Yeah.
mean, deceased in the sense that has a disease. If you screen for HIV and is positive, it means that person has HIV. Too late. You can only prevent the sequelae happening. If you screen women for breast cancer, if a woman is positive for breast cancer, it means the woman has breast cancer. But it's not the same for cervical cancer. If you screen a woman for cervical cancer and the woman tests positive, it's actually a victory of medical science. It means that, thank goodness, we have a chance to stop this woman from going ahead to develop cervical cancer.
Mm.
Because what screening for cervical cancer does, it doesn't aim to detect cervical cancer. It aims to detect one who has HPV that causes cervical cancer, two who has HPV that she cannot eliminate, and that HPV has initiated a process that may lead to cervical cancer. So you
Right.
can see that we have two opportunities now to prevent cervical cancer.
Yes.
One, prevent exposure, prevent the institution of HPV by giving a vaccine. But two, even where the woman has been unfortunate enough to have the HPV, and the HPV has already initiated the process of carrying her toward cervical cancer, that process can be arrested
Yes.
before cervical cancer ever develops.
Spreads.
Not spreads, before it ever
Develops.
develops at all.
Mm.
Can I give you a simple corollary by which people may understand?
Okay.
I
Please
think it's
do.
important that we dwell on this a little bit because I've heard women who have been offered screening and they say, I reject it, it's not my portion, no, I can't have it. Good. Now, screening for cervical cancer, if for instance we say that we're going to screen people for cervical cancer, and as long as you remain in this room enclosure here, or
Yes.
wherever you have women in the hall, you
Yes.
say the normal. Now, the end point, women who are, shall we say, inside within a stadium, okay, that's the end point. Women who are within that stadium have cervical cancer. Women who are within the hall are normal. Now,
Yes.
there's a long road between that hall and the stadium. Some women would be on the road to the stadium or to wherever. When you screen them, they are positive in the sense that they're no longer in the room or they're outside. But are they going to the stadium? We can't tell because they may very well walk back in.
Gotcha. Yes.
Yes. But there are some who would move very close to the stadium door. But as long as they have not crossed that threshold, they've not bought the ticket and gone into the stadium,
Stadium. Yes.
they are still positive, but they don't have cancer, and you can still redeem them. There are things that you can do to stop them from getting into that stadium. The ones who have lost it, the ones who are unfortunate, are the ones who have not been stopped from buying the ticket and getting into that stadium.
Stadium. Yes.
So the woman may be on the long road, and when the woman is screened positive, she's somewhere on that road.
Yeah.
But when a woman is screened positive, it does not mean that she will ever develop cervical cancer. Quite a number of them will come back into the room.
True.
Quite a number of them are going somewhere else. But medical science at this stage does not know who is going to go ahead and enter that stadium or who's going to go ahead and come back into the room. So when you are screened positive, it's not a death sentence.
Okay.
But it just means we have an opportunity to stop you from going any further.
Fantastic.
That is
Yeah.
the advantage of screening for cervical cancer. Unlike HIV, when you screen for HIV, if it's positive or she's already in the stadium, how do
Yeah.
we stop her from getting worse? With cervical
Exactly.
cancer, we have the opportunity to stop her from going further, depending on how far down the road to the stadium. Some women are just outside the hall, and we say, okay, you're just outside the hall. No need for treatment. Come back next year. We'll keep opening the window to look. Is she still there? Is she still there? Don't worry.
Yes.
But when we look, she's gone out of sight. She's gotten near the stadium. Go and catch her. Go and treat her. Stop her from getting into the stadium. That is the story of cervical cancer. So it's a
It,
lot different from HIV
it,
and breast.
oh, it's fantastic. That analogy. It's really nice. That makes one. I'm sure it will make one understand more what it's all about, and chances for survival. So, who should be screened? Women, men,
Yeah.
everybody, both genders.
Who should be screened? Women, because they are the only ones who get cervical cancer. A man doesn't have a cervix, so he
Yeah.
can't get cervical cancer. It's the woman that need to
Okay.
be screened. So, which woman should be screened? It depends on which part of the world that you are practicing, really. In the Western world, in America, for instance, as long as you've been exposed to sexual activity, you qualify to be screened. And mind you, screening is not a once and for all thing. The frequency of screening also depends on what program and which country you are. Some countries screen their women every year. Some screen their women every 4 years. And don't forget that I've told you that in the new day and age, the probably most cost-effective form of screening is HPV.
Yes.
In other words, you get the woman and you screen her by applying tests that will tell you if she has HPV. If she doesn't have HPV, she can go on her merry way until the very next schedule of screening.
Mm.
If she has HPV, you now step her up to the next level of screening. In other words, to determine how far instituted is this HPV, how much initiation towards possible cervical cancer does she have? Do you understand?
Yes.
Do I
Very much. Yes,
So it's
absolutely.
the woman. Any woman who is sexually active should be screened. Frequency of screening depends on the program. Some countries yearly, which may be a waste really, because the most successful screening programs are actually in the Nordic countries, Sweden, Norway, Finland. And
All the Scandinavian countries, they have fantastic screening processes.
And the screening that they did that would drop their cervical cancer rates was actually the pap smear. And they did it every 4 years. So if you're getting good quality screening, if you're positive, if you are negative now, the chances of being positive in the next 2, 3, 4 years is very little. But in some countries that have the resources, they screen every year.
Yes.
And where the advocacy to the developing world is that even if you can succeed in screening a woman once in her lifetime, you succeed in bringing down the level of the cervical cancer.
Yes.
Because at the moment now, there are very few developing countries that have any screening programs in place. So the women are just going along their merry way.
Not knowing what is happening in their bodies.
Absolutely.
Yes, I understand. Could you take us through the screening process? What is actually involved during the screening process? Because a lot of in many cases and many stories that I've read, when you talk about a woman going for a screening, for any screening tests, any, not just cervical, anything that has to do with her being vulnerable, she's already put off. No matter how hard you try to tell her, listen, it's for your own good. But could you just take us through the screening process a bit?
Yes. If I may start from your last sentence, that she's immediately put off.
Yeah.
That is just natural. And you can't help it. Some women are just built that way.
Yes.
But the medical world is trying to discover ways by which that can be sidetracked or ameliorated so that you don't subject every woman to the process of
it's psychological.
It's psychological. But I'm going to develop my argument to the point where I'm going to tell you where medical science is at the moment. The traditional screening would require a woman to present herself in a hospital or a health facility where she will be put on the table and spread out in an undignified, if you like, way.
Yes.
And have her privacies intruded upon, and shoving speculums, shoving instruments up her most intimate of places, and then taking a swab. So to a lot of women, this is agreeable, but also to a lot of women, it's not agreeable.
Yes.
Now, that is the process. Every woman now who needs to get screened will have to go through that process. See a health practitioner, get on the table, have some instruments put into you gently, and then just have a brush rubbed on the cervix. And that brush can now be sent to the laboratory to find out if there is HPV, if that is what the screening method you're using, or sent to the laboratory to find out if there are what we call dysplasia, is a woman on the road already.
Mm-hmm.
The specimen is sent to the laboratory, and the woman will, in a matter of days or thereabouts, come back and get a report. But
Excuse me, just to go back there before I forget. You made you said something. Is the woman on the road already? What does that mean?
on the road already means she's positive, she's screen
She
positive.
is positive, yes, so that our viewers would want
Will
to know what.
understand. Yes.
Yes,
And
yes.
the road already, like we agreed, doesn't mean on the road to the stadium.
Oh,
She
sure.
could be on the road to visit a friend
Mm-hmm.
and come back in,
Mm-hmm.
because the truth is, even when you are positive, it doesn't mean that you are going to go along into the stadium. You
Sure.
may, on follow-up, become normal even without any intervention. No matter how far you have gone towards the stadium, you may always come back even without any medical intervention. But it is safe to treat women depending on how far down the road
Mm-hmm.
they are to the
Yes.
stadium. Yes. So now I was talking about women who would not like to
I'll
expose
put
themselves,
off.
who
Yes,
are
I'll put
put off.
off.
Yes.
Yes.
In these days, there are some novel screening methods where the woman in the privacy of her home may insert like a tampon into her private parts and seal that tampon in an envelope and dispatch to the health authorities, who will now,
Wonderful.
who will now look at that and put it through the tests to see whether she has HPV or not. But at some point or the other, she may need to come in, especially when she's screen positive. But having that facility available where women can self-test and
Mm-hmm.
self-dispatch specimens to health
Mm-hmm.
facilities, I think
Mm-hmm.
is a welcome idea for
Oh,
women who,
that's
yes,
fantastic.
may be
That's
put off.
fantastic, honestly. For women, it's like your pregnancy test, where women, test themselves if they're positive or negative. This HPV one should be made available um, as much as possible, so that women in the privacy of their own homes can. It's like wearing a tampon, as you say, using the tampon, and then sealing it up and sending it over to the medical facility, and either being asked to come in, or everything is clean and clear.
Yeah, it sounds good, but it has some little drawbacks. How the
What are
women
the
are,
drawbacks to this?
well,
Every
sometimes
novel idea has a
has a
drawback.
draw.
What is the drawback
Yes,
to this?
yes. Some women may insert it incorrectly or may not get enough material to send to the laboratory. Such
Okay.
little things, but I think it's still under development too. But from comparative studies that have been done,
Mm.
physician applied tests for now are yielding better results than client applied tests for a lot of reasons. Either the specimen gets contaminated on the way or gets dried up before it gets to the facility. Such little
True.
concerns exist, which I'm sure are not insurmountable
Mm.
eventually.
I'm sure, because maybe there could be ways. I mean, I'm also looking at our own country, where the weather, there should be also drop box facilities for, like, where you are, a national hospital. You could say there are drop box facilities there, for women who would do this and all that. It would be so. But I still see that the pros still outweigh the cons in that sense, because the whole idea is to get as many women as possible to get tested.
Absolutely.
And so the issue of eliminating that fear and reluctance should be priority, one's prerogative, so that more women go there, and there are less cases regarding cervical cancer. But that
I
would be
agree with
good.
you. I agree with you.
Yes, that would be excellent. Honestly, that would be excellent. So, we have already touched on the pros for concerning prevention by vaccination and all that. But one thing I'd like to bring about is the controversy surrounding the HPV vaccine. There's a lot of controversy regarding that. We read about it every day. Many believe that it gives adolescents the right to go out there and have sex without any qualms, without any reservations, not giving two hoots about what could happen to them. Um, because they're confident that this vaccine may or would prevent them from having any disease. It is also said that the vaccine sterilizes young girls, the same adolescents that these are made for as well, young girls and boys. Another rumor is that it is a ploy to control Africa's population by Western powers, and that's why the vaccine was introduced. Uh, Dr. Olaniyan, please tell us what's your take on all this? Um, uh, Most people say, no, 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 I'm not going to allow my daughter get the HPV vaccine. She's not going to have children, blah, blah, blah. Same with my son. What's your take on all this? Also as a parent.
Well, very good. Now, conspiracy theorists have existed from time immemorial, and medicine is a slave of statistics. Medicine has an end point which is defined, and that is not, there's no controversy about that. Now, about it becoming a license for sexual immorality is not within the purview of the scientist to decide that. The scientist comes and tells you, if I give you this vaccine, you won't have cervical cancer. And that is my end point, and that is what I'm concerned about. Now, the patient A, who would be sexually immoral without having the vaccine, doesn't stop her from being sexually immoral. So the duties are compartmentalized. There are moralists who should take care of that angle of preaching sexual morality, abstinence, and what have you. But as scientists, we have an end point which we're aiming at. And the fact on the table is that getting HPV will prevent you from getting cervical cancer. And I don't think it would be fair to expect scientists to also take on the hood of moralists. There are very, very well established institutions who can do that, who are better able to do that. Now, as to the fact that whether it will sterilize is a ploy to sterilize the girls and make them not have children, I would have you know that this vaccine has been instituted in all of South America, in all of North America, in large parts of Europe. The vaccine is now part of their routine immunization. But in Africa, probably one country up north, North America, has been planning since 2013 to institute it. And I don't think they have started just yet. I'm just telling you that it's the same vaccine that is available all over the world, that is being given to women in South America, women in North America, women in Europe. The same vaccines are the ones that are available in developing countries for those who can afford it. In these countries which I've mentioned to you, it's actually a matter of government policy to give everybody who is at risk the vaccine. In Australia, for instance, they have 100% coverage. They not only immunize the girls, they immunize the boys too. So it's a conspiracy theory to allude to the fact that it's meant to sterilize our girls, it's meant to make them unable to have children. I don't subscribe to that. These vaccines came into existence quite a long time ago. And the people who have had those vaccines have gone on to have children. So it does not sterilize. I can only tell you that it is wrong.
Okay.
That's as much as I can say about that.
Thank you so much. Thank you so much for. um, so, does the vaccination, having the vaccination, preclude screening, or it's screening first before the vaccination? What's the sequence?
The sequence, the textbook sequence, if I may use that phrase, is to give the vaccination ever before sexual activity to young girls. In the
Young girls between what ages?
8 and
Because
14, between the
as
ages
soon
of
as
8
as soon as they start their menstruation, or
before,
before then, because
before,
girls are starting their menstruation much earlier now.
yeah. The prescribed age, the ideal age to which they are most responsive and will produce enough antibodies to prevent HPV is between the ages of 8 years and 14 years. So before they are sexually exposed is the prescription. That is the ideal time to vaccinate them. There's what you call catch-up vaccination, which may occur in government-sponsored programs up to the age of 25. In government-sponsored programs, the targeted age group is 8 to 14. Bring your children, 8 to 14, we'll pay for them. But in some countries that extend it up to the age of 25, some people, some scientists, there's evidence that is now coming to fore to show that even where you have been sexually exposed, and I think we're getting into the realm of controversy here now, that even where you have been sexually exposed, you are still likely to benefit from vaccination because there are about 10 or a dozen types of HPV that can cause cancer. There are about 100 types of HPVs available worldwide, but the ones that are actually carcinogenic, oncogenic, in other words, those that can make a woman develop cancer, are just about a dozen or thereabouts. Now, the state-of-the-art vaccines can protect you against 9 of those HPVs. But luckily, there's a cross reaction. In other words, if you are protected against HPV 9 types, sometimes it can overlap and prevent you against exposure, against the risk of more HPVs.
Oh, that's great to know. That's so great to know. So if one is diagnosed, what are the chances of survival? If one if
Yes,
one is diagnosed now, what are the chances?
yes, thank you. I just remember I left out a part of your question, very important part. You asked that does HPV vaccination preclude screening?
Screening, yes.
No, it doesn't.
Okay.
No, it doesn't.
Thank you. Thank
For
you.
several factors.
Okay.
There are so many potential pitfalls to HPV vaccination. Potential, which cannot just make you rest on your oars and say she's been screened. Like I said, the state-of-the-art vaccine these days protects you against 9 types of HPV types that can cause, but there are actually more than that. But the most common ones have been protected against. But a woman may be unfortunate enough to get an uncommon type that may still make her have cervical cancer.
Cervical cancer.
Yes. And then we live in a real world. A woman may get exposed to a vaccine that is expired or a vaccine that has fallen off the cold chain. A lot of reasons why the vaccine may not be effective.
Follow off the cold chain. What does that mean?
Falling off the cold chain. In
Meaning?
other, meaning these vaccines are designed to be kept at particular temperature
Yes.
from
Like
manufacture.
chemo drugs.
Yes, like some chemo drugs.
Yes.
Yes. These vaccines have been designed to remain at a particular temperature from manufacture onto administration. So sometimes maybe the ship bringing them over, a fault may occur somewhere and it falls off the cold chain and the temperature rises and then somebody puts it back in the fridge. So you can't rule. We live in a real world.
True.
Yes, humans are prone to error.
Yes.
Again, like I said, the vaccines may not protect against all types of cancer-causing HPV. So the fact that a woman has been vaccinated does not mean that she falls off the screening radar. She must still be screened at regular intervals.
Just to make sure that everything is,
Yes, everything
contained.
absolutely.
Contained.
Yes.
Yes.
So now to go to your question on survival of cervical cancer, right?
Yes, sir.
Good. Before that, allow me to talk about treatment of people who are screened positive. The treatment, assume you've screened the woman, she's got HPV, she's on the road to getting cervical cancer. In other words, she's near our proverbial stadium.
Yes.
The treatment for that is to chain her foot down by the stadium gate, so to speak. And it takes, medically, we can cut off that part of the cervix. It's a procedure that takes about 5 to 10 minutes.
Really?
Yeah. And the woman can come from her office and get treated and go back to work. There are other methods by which we can institute, even in the village where there is no light. We can freeze that part of the cervix. If you freeze that part of the cervix, it sloughs off over some weeks. We would have frozen away the area that is abnormal, and the woman will shed it over weeks.
Yes.
That method is suitable for places where they are technology deprived, health specialists, practitioners deprived, electricity deprived, and such. But they can still be treated by freezing. Cryotherapy is called cryotherapy.
So would it be like in sprays, or what is it that they'd use? Like some sprays to be able to freeze, or?
Like a spray. It's much like a pen.
Like pen,
Like a
okay.
pen. The pen would be applied onto the surface of the cervix.
Okay.
And the gas, usually carbon dioxide or
Yes.
some gases, will escape from there. And as I don't want to be too technical, as the gas is escaping, the temperature is cooling and is freezing away that point where that pen is touching. And in 5-10 minutes, you take your pen away, and the woman can go on her merry way, and she's been treated. But in the other centers, like if you were in the Western world, or if you were in my hospital or teaching hospitals in Nigeria, we can do what you call a loop excision using a hot wire to cut away that part of the cervix that has the disease, which is not yet cancer, but which, if left untreated, may become cancer. And that treatment is about 5-10 minutes, and the woman can go back home that same day. Now to the treatment of cancer. The woman has to come. I'm giving you a typical example. Her relations have to come. Her husband will leave work. Her mother-in-law will come. The sisters who are in America will send dollars home for radiotherapy, for surgery, which very often will dislocate the whole family, and very often not very
too expensive. Too expensive.
Very expensive, and not usually very, very
good results.
Yeah. The results you get depends on how early in the stage of the disease. Now we're talking of outright cancer.
Yes, sir.
Yes, treatment and survival of outright cancer. The earlier the cancer is detected, the better for the woman. There are some women who, from the screening, we will tell her, even before she starts having signs and symptoms, she's gone for screening. Some of them will actually have cancer already, and it will show in the tests, in the samples you have taken from them, that there is cancer here. But you have gained time. You have not waited for her to have bleeding,
full-blown cancer.
Yes.
Yes.
And if you treated such women in whom the disease is localized to the cervix, we'll talk of 5-year survival rates. Cancer, yes. Meant 2 to 95% of them will be alive after 5 years. Fantastic. Where the cancer is detected early. Where it is regional, where it has spread beyond the cervix to the other parts, the vagina, and the local organs in that same region, the survival rate drops immediately to maybe about 50-56%. When it goes distant, it's gone to the lungs, it's gone to the bladder, it's gone to the rectum, is far exposed. The survival rate after 5 years is just about 10%. Okay. And I will tell you, Grace, if we see 100 cases of cervical cancer, if we get 100 cases, are you with me?
Yes, I can hear you. Can you hear me?
I can hear you very well.
Okay.
If you get 100 cases of cervical cancer diagnosed in the hospital, about 80% of them are coming in the advanced stage, when it's almost too late to do anything. And some of these women, an experienced practitioner can diagnose in the market, in the supermarket, in the bus, in church, in the taxi. An experienced practitioner can sit beside a woman and know that this woman's got cervical cancer.
Wow.
Because it will be so far advanced, and there's a kind of stench that emanates from the woman that is typical. That just walking on the street, somebody who is well experienced can tell. So you can imagine, for something that is completely preventable, women have allowed it because of ignorance. They don't even know there's something called screening. They've allowed it to fester for so long until it becomes, the most horrible thing that you can think of. Purulent discharge, bloody discharge, the whole room, nobody can stay in the room with the woman. Okay? That is the difference between the developing countries like ours, where we reject screening, we reject vaccination.
It's not our portion.
Not our portion.
It's not our portion.
Yeah, in the Western world, if you find a woman that has cervical cancer, she will be got maybe in stage 1. And very likely she has come from the developing country to that part of the world.
Yeah.
But in our part of the world, if you get a woman that has cervical cancer, she's very likely in advanced stages. Because we don't have screening, we don't have vaccination. People are ignorant. They don't know the risk factors. Okay? So such women who come to the hospital, most times we are initially battling with even keeping her alive at all, because she would have bled so much that she's so pale and she requires blood transfusion before you can go to the theater and take a sample. The test that you need to do to stage her, she would have expended all the money in the church, in the mosque, with the native healers, with traditional healers, and then they come to the hospital when they're almost down and out. That is the tragedy of what happens with cervical cancer in our part of the world, unfortunately.
That is so, so sad. That is so, so sad, honestly. That is why this awareness, the awareness drive, because by them being reluctant and probably shy or, stigmatized, as in the case, for a lady to wait until that begins to fester, I mean, there are people living with you in the house. Somebody has to say something, I mean, concerned people, families, citizens would just bundle her, and it's not something that you can hide anymore once the stench, and she herself would be very uncomfortable. But I'm so happy about that, that there are interventions that seek to nip it in the bud before it gets, overboard. You know, I like the parts where you said that even in the villages, the pen-like
Instrument.
instrument that is used. But one thing that came to mind as you were talking, would they already have done a scan for them to be able to know exactly um, before that intervention with the pen is used for them to be able to freeze her?
No, no. They don't need any highfalutin, rooting, tooting technology. You
Okay.
need, yes, you need common, the same vinegar that you put in your salad is what is used to do the test. There are several screening methods. I didn't want to complicate matters. I spoke about HPV, I spoke about pap smear. There's one particularly suitable to our part of the world called VIA. That is visual inspection with acetic acid. The acetic acid is vinegar, the same
Wow.
vinegar that
But
you
that
will
we use
put in
for
your,
washing our fruits and everything.
absolutely, and you put in your salad, yeah.
Yes.
If a trained practitioner applies vinegar to the cervix of a woman who is who has HPV and in whom the HPV has caused some problem, the abnormal areas can be seen. They will turn white. The vinegar will make them turn white. And the practitioner can now take that pen and apply on that area that has turned white and freeze it off, burn it off as it
Okay.
were. So there's
Okay.
no need for any scan, no need for any x-rays. The woman comes from her farm, from the village, gets on the table, and you can actually train non-physicians to recognize these things. Community health extension workers, teachers, you can train well-trained teachers, well-trained health, low-level cadre without
Workers.
gynecologists.
Yes.
Yeah. You can train them to put vinegar on the cervix and to recognize abnormal areas and to freeze that abnormal area so that the woman is saved from going on to develop
Yeah.
cancer. Don't forget,
Oh,
they're not
wow.
cancer at that stage. They're
Yes.
not treating cancer. They are treating the effect of HPV
HPV.
cervix. They are
The
treating the woman
virus.
on the
The
road.
virus. Yes.
They're treating the woman on the road.
Excellent. I'm so happy to hear that. That's so good. That's so good. So, um, Dr. Lanio, after your very hectic, we're going personal now because all work and no play makes Jack a dull boy. After your very hectic schedule, how do you find time to unwind? What do you do to, get yourself in the zone?
If I told you, Grace, I would have to shoot you. I'm just kidding. I'm just kidding. Well,
Because your job is hectic, and especially you have to be at the at your place at Greenacres, and then you have to be at the hospital. You have family, children, grandchildren. It's not easy, so you must have time for yourself to be able to stay sane. What do you do?
well, thank you. What I do, my my profession is science. My vocation is art. What I do, I enjoy photography.
Nice.
I enjoy photography immensely. I shoot like anything and everything. I enjoy music immensely. I I try to play the saxophone. I
Great.
They actually belong to a jazz club, the Abuja Jazz Club, which you should come. We have our sessions every Friday
I love
in
jazz.
Abuja.
I'm a jazz
Yeah,
fanatic.
yeah. So I'm a jazz saxophonist too. And then again, I like to play golf. Yeah. And when I'm not doing these things, I like to be with family.
I know. I know. I
Yeah.
know. You're a grandpa now.
Thankfully, yes. An adorable grandpa.
Oh, grandpa. Oh, bless. That is so nice. That is so nice. So if you had to do it all over again, Dr. Olaniyan, would you come down this path? Would you do medicine? Or probably you would have gone into music maybe or photography, who knows, with your passion.
Well, I'm not sure I'm good enough to be a professional musician or a professional photographer. But in all honesty, the kind of fulfillment that I get from this job sometimes, I think I would still do the same thing.
Fantastic.
I think I would still do the same thing because quality care is very, very lacking in my kind of profession.
Mm.
And I very often get people who maybe have been misdiagnosed somewhere, and when I get them, the most happiest times are when I look, and I tell them, I don't think that guy was right. I don't see any cancer here. Or in other cases where the woman has been diagnosed to have cancer and we have treated her, and then I'm still seeing her 5 years, 10 years, and she's still coming in and out. It makes me happy to think that I've had an impact on that
Yeah,
person's life. So I think
exactly.
I will still go down the same path. I would.
Mhm. We would still love you to be on this path, Dr. Lanio, because you have saved lives. You have saved lives. I mean, I've come to your setup and really I was very, very impressed. Not
Thank you so
because
much.
of anything, but that's the truth.
Thank you so
That's
much.
that's
So
the
much.
truth. Your dedication is very obvious. It's very
Thank you.
obvious. Thank you. So I know you have shared a lot of knowledge with us, but before we round up, is there any extra word of advice you'd like to give, our viewers, the men and women out there who will come across this video regarding this timely topic? What advice would you prefer?
Uh, to the woman, get screened, get screened, and get screened. It never comes home until it comes home. When you hear these things on radio or programs like this, you think, oh, it's for the next woman. Until you go and get screened. Now, when you get screened and you're positive and you don't have cancer, you should say, oh, very good. Now there's an opportunity to stop me from getting cancer.
Mm.
Get screened. That's my message. Get screened. Get your children vaccinated. Don't listen to conspiracy theorists who say it's to sterilize them. It's all over America, it's all over Europe, it's all over Australia, it's all over. Get screened and get your children vaccinated. That's my message.
Thank you so, so much, Dr. Lanio, for finding time to share your expertise and wisdom with us.
Thank you so much, Bruce. It's a
May
pleasure to
God
be here.
yeah, may God continue to give you long life to be able to help others as well.
Amen.
Thank,
Amen. Thank you so much.
thank you. So, my dear audience and friends, there you have it. If you haven't yet joined us on Facebook, Cancer Converse with Grace B, please go so and like our page and subscribe on our YouTube channel under the same name, Cancer Converse with Grace B. So, this is Grace B signing out, wishing you all peace and light. Take care.